Do you have hair loss with IBD? Let's talk about it. So, why do we have hair loss with IBD, number one? And what are some things that we should be thinking about when we start to see either hair loss or thinning? Hair loss, in terms of the way that we look at things, we're always looking at physical signs of nutrition as dietitians. So, hair is another way that we look at that. And it can give us some insight into what might be going on a deeper way. It can prompt other questions that we might want to ask you. There can be a number of reasons why people with IBD would have hair loss, some of which is medication, stress, like the stress of the diagnosis, the stress of having IBD, outside stressors, but also nutrition. And the biggest thing that comes to mind for us when it comes to that is malnutrition. So, what are some things we know about malnutrition? Let's start there.
Goodness, where do we start? When it comes to IBD and malnutrition, I feel like especially upon first diagnosis, malnutrition is quite high because we see people avoiding foods or not being able to tolerate a lot of foods. So then, of course, people may avoid foods. We see rapid weight loss in IBD at times. So all of that together can put someone in a more malnourished state, as well as that ongoing inflammation. And if we're not eating enough, can just further exacerbate the malnutrition.
Yeah, I think a lot of people with IBD, myself included, when I was first diagnosed, don't put a lot of weight on the malnutrition piece because we're just trying to survive, right? You're just trying to survive when you have IBD. You're trying to get by the day without having symptoms. But I don't think we connect the dots often that, malnutrition, it does actually lead to worse outcomes in the long run. So we see people that are less responsive to medications. Your body's just not in the best state to respond positively. And then, in the long run, it can actually increase your symptoms, which is something not a lot of people know about. And I feel like it can kind of repeat this cycle to where you get to the point where everything feels like a trigger and you're not sure where to start. And, you might have multiple nutrient deficiencies, might not getting your baseline needs met. And for over the course of a long time, that can really play a bigger role in the trajectory of your disease and just how you're doing overall. And even your stress resilience, so your ability to cope with stress, can suffer when you're malnourished. And so, we get questions a lot around hair loss. And I think the immediate thoughts of like general public is, let's go get a fancy hair shampoo or let's go get biotin. But I can't emphasize enough how important it is to look at the larger picture, especially with IBD. So we want to look at malnutrition and make sure you're getting your needs met. We want to look at your nutrient deficiencies, and stuff like zinc and iron, I feel like gets looked over when it comes to that. And same with your protein intake overall, vitamin D, your folates, all of those nutrients can be important and play an important role in, hair. The keratin, the actual hair loss can play a big role in the overall picture.
So I guess some initial thoughts if you're experiencing hair loss with IBD is, one, are you inflamed? If you're inflamed, that can contribute to hair loss. Discuss with your doctor if any of your medications are contributing to that. Check your nutrients, of course, iron, zinc, and getting enough protein or enough food in your day in general is other things to think about. But also, if you're looking at all of that too, it doesn't hurt to take a look at your thyroid levels as well, just to ensure that that is not a contributing factor either. So it's not as simple as just thinking like, okay, biotin supplement, let's go. We want to explore these other things as well to ensure that we can maximize your nutrition where we can to help decrease hair loss or potentially prevent it from getting any worse.
Mm-hmm. I guess collagen is the other one that I've seen people take quite a bit of for that. None of these things are bad or anything on their own, but it's just more so like you really want to view it as like a vital sign. Like when we think about like the vital signs when a doctor assesses you, and dietitians have, their own like vital signs. So you're checking for how nourished you are and if you're at what state your body's in. So yeah, you think of it as an invitation to dig a little deeper.
I like that. Yeah. An invitation to dig deeper. Absolutely.
Yes. So if you're somebody that is struggling with hair loss or maybe has some of these other signs that we talked about, reach out. We have 3 different ways that you can work with us. You can check them out below or on our website. And don't forget to subscribe.